reaching menopause, so estrogen, progesterone. Now if the uterus is intact, then what we are doing? We are adding both estrogen and progesterone, and here now we have two choice with us. If you really want to give the withdrawal bleeding, at least in the initial phase of the menopausal HRT, you are giving estrogen for say calendar day 1 to calendar day 25. You are adding progesterone from calendar day 15 to calendar day 25. So from day 1 to 14 you are giving only estrogen. This is one of the schedules, there are many schedules that way, and from day 15 to 25 you are giving both estrogen as well as progesterone, then you give a withdrawal. Usual withdrawal in 4 to 5 days one should get the withdrawal bleeding. If the withdrawal bleeding is happening, then you again, after the bleeding is over, you again restart the HRT. If the withdrawal bleeding is not happening, then you start still after 5 to 6 days. So every calendar day first you are starting the HRT, even if the withdrawal bleeding is not happening. In 3 months, if there is no withdrawal bleeding, no spotting, no dysfunctional uterine bleeding, that can happen initially, right? You do the ultrasound, you see the endometrial thickness. You know the previous thickness, which was say 2 mm or 3 mm before starting. Now if you see the thickness is becoming 11 mm, 12 mm, you know that estrogen is proliferating a lot. Now you can tell the patient that you may get a withdrawal bleeding. Once you have 14 mm of endometrial thickness, the chances of bleeding becomes more. But that is the time when the shedding off happen. So here you can follow up the patient. Okay. Now few patients says that we don't want a withdrawal bleeding. No, we don't want. ऐसे भी लोग आते हैं. So there you give continuous estrogen and progesterone. You can give continuously. Okay. But initially for first year at least you keep a check on the endometrial thickness by doing the ultrasound. So every 3 months or 4 months you can do the ultrasound. Patient still can have the breakthrough bleeding or maybe spotting and all. For this you have to counsel the patient. See, uterus is one thing again which is under influence of lot of factors, and there is anatomical factor, there is physiological factor, there is mechanical factor, the weight factor itself of the endometrium which is being proliferated. Clear? Now how long you can give it? Dosing I will come. How long you can give it? So same way like you were planning for your for your andropausal HRT or growth hormone, that ideally you can give it for 5 years in a row. But if you are, again nobody wants to take continuously, again you can go, you can give for 8-9 months, you can give a withdrawal of 2-3 months. Again you can give for 8-9 months, you can give a withdrawal of 2-3 months. This will decrease. One is the dose escalation would not be there, psychological dependence would not be there to that extent, it will still be there, and the third will be the cost factor which is equally important, right? 3 things you will take care by this off and on. Otherwise you can even continue if the patient is comfortable for that.